I am Dr. Fahad Umer. I'm an associate professor at the Khan University Hospital. I'm very, very pleased to be invited to this meeting today. And I'm very thankful to both Dr. Syed Athar Inam as well as Dr. Seemal for inviting me, and especially Dr. Seemal for coordinating this session for us. Um, so I'm going to also take this opportunity to tell you a little bit about us and what section of dentistry is like and what I do. So section of dentistry is actually a section in the Department of Surgery at the Khan University Hospital. It is one of 11 sections. Um, we are very fortunate to be part of Department of Surgery, which is the flagship department of Khan University Hospital. And our previous chair was Dr. Syed Athar Inam, who took this department forward, and now it's being currently chaired by Dr. Salim Islam, who is a pediatric surgeon. Section of dentistry has 3 residency programs, and we have around 24 residents in our program. As you can see, the induction day slide looks very populated. And we are a thriving group who are service providers as well as researchers. My day job is actually, I'm a dentist. I'm a restorative dentist and an endodontist. And I usually tease my neurosurgery colleagues by saying that I'm a neurosurgeon of the tooth. Um, my super specialty entails using magnification and doing microsurgical procedures, for which I got training at University of Pennsylvania. So what that means is that sometimes stuff goes wrong with root canals, which mortal endodontists are not able to deal with. So they send their patients to me. This here is depicting the value of magnification in root canal treatment, in which an instrument was separated, which was later retrieved by specialized equipment that we have. Surgeries at the back of the mouth, again, areas where magnification and illumination is required. We also sometimes take teeth out of the mouth and treat them outside the mouth and place them back in. So a lot of interesting stuff from clinic service perspective. My interest in AI developed actually 4 years ago. And we've been working with different kinds of AI-based models. Mainly, it was classification problems that we were doing, image detection, etc. This is an image of the lab that we're using. It's a makeshift room with GPUs in it, and we have specialized annotators, dentists who help us with annotating our images. We also have front end as well as back end engineers who work with training the algorithms and also making deployable solutions. So my research philosophy over the years has developed or evolved to be more in line with what the institutional as well as the global perspective is. And so now my research philosophy is revolving around sustainable development goals. And for the benefit of the listeners, in 2015, the United Nations came up with 17 sustainable development goals, which essentially meant that uh, countries or the global community as a whole needs to progress together. And in order for us to make this progress, we have to concentrate on certain themes, these 17 themes to be exact, which revolved around not only environmental sustainability, but also looking at disease, poverty, inclusivity, as well as education, to name a few. And being a part of a academic medical center, it made sense that we look at the 2 most important sustainable development goals that we can make an impact on. This is good health and quality education. Pakistan has made a lot of progress in sustainable development goals. However, still, we are behind. So I think from the perspective of Pakistan, we stand at a watershed moment in which AI can somehow fast track our development in terms of the sustainable development goals. So for example, in healthcare, we all know this, that access to health is difficult. And therefore, AI and digital solutions may actually democratize health and improve access to health. Likewise, efficiency of diagnosis and prognostication can also be improved with the use of AI. We, as a low-income country, can also utilize AI-based solutions to optimize our resources, be it human resource or physical resources, a little bit better. Likewise, when it comes to education, we know that there are different kinds of learners with different learning preferences. So AI can be used to do personalized learning. We can also improve access to education for urban population by using digital solutions. And then based on all this data that we get, we can make informed decisions. So you will notice throughout the course of this presentation that most of my work around AI has been geared towards these two problems and trying to improve access as well as improve efficiency and efficacy of diagnosis. So just for an example, in dentistry, and please note that most of the examples that I will be stating would be based out of dentistry, but they are all transferable learning. So whatever we talk about today can be translated to other forms of healthcare too. So here is an example of trying to democratize health using mobile health solutions using artificial intelligence. So one problem that we face in dentistry is that most of the data with regards to oral health is coming only from urban population, and we have almost limited or no data coming out of urban population. This is largely because Pakistan still struggles to have healthcare providers who are enough and would be able to go out into community. So one intuitive solution that we came up with was, imagine if we had AI-based app in which so we already have lady health workers as well as polio team workers who go into the population and doing this these surveys as well as giving out vaccinations. So imagine a solution in which you enrich these workers with an AI-based solution, which can be installed into any kind of Android phone or an iPhone device, and they just do these pictures. When they do these pictures, the AI will detect the decay in the mouth or any other diseases in the mouth. So here is an example of an AI-based solution that we've already deployed and we're testing out in MITI, where this AI-based app actually looks for decay and populates a centralized dashboard and let us know that what is the disease prevalence in that given population. So certainly it's very useful from a public health perspective, in which these solutions will let us know how we can make intervention at a population level to make an impact which is more generalizable. So again, an example in which AI can number one, democratize healthcare, improve access, as well as improve diagnostics. So November 2020 marked the ChatGPT movement. It was a landmark movement because although us researchers were aware of AI and been working with AI for more than 2-3 years at that point in time, but the population didn't know or didn't truly realize what artificial intelligence had to offer. So when ChatGPT was launched, this was heralded as a disruptive technology. And for a disruptive technology is any technology in which changes how people think and how businesses operate. It from an economic standpoint, um, it has been valued that AI will add around $5 trillion to the global economy. Imagine that that's almost 5% of the total GDP. So AI based solution, and AI is being heralded as the fifth industrial revolution, and all kind of companies are benefiting from it, and likewise healthcare is also benefiting. The concept of AI, however, is not new and it's been around since early 1950s. And this is the picture of Paul McCarthy. And this was done at a conference in Dortmund. And this is the time when the term AI was first coined by this gentleman. So if AI has been around for so long, what's going on? So although AI has been around for so long, it has gone through different times of renewed enthusiasm and then a decrease in enthusiasm. And this has been largely been attributed to, I think, three things. Number one, when the concept was still there, we didn't have the computational power to work with data and make these large computations that need to be done to utilize artificial intelligence. Likewise, we did not have access to a large amounts of data which can be utilized to train AI algorithms. But renewed enthusiasm actually came in the field of AI, especially in disease classification and radiology, back in 2012, when convolutional neural networks made a big breakthrough in which they won the ImageNet challenge, and they were able to show that AI-based solutions were as good as human experts in making classification when it comes to images. And this was largely attributed to now us having access to large computational powers based out of GPUs, as well as large data sets which are publicly curated, such as ImageNet, as well as Microsoft Code. And before the advent of ChatGPT, we usually used to classify AI into subdomains of machine learning and deep learning, in which machine learning was characterized as statistical methods in which you had to do calculations, or at the very least had to do some kind of feature extractions. And then those statistical methods would make predictions based on those features that you would extrapolate for it. But when convolutional neural networks came, the concept of deep learning became more modern at that time, and everybody wanted to utilize deep learning for image classifications. And these were loosely based on human neurons, in which you didn't have to explicitly classify what you see in that image, and then you just had to provide labeled images, and AI would make classifications based on those labeled images. So this is before the advent of ChatGPT, and this was the kind of work that we were looking at that point in time back in 2019 or 2020. But then in November 2022, ChatGPT came in. We had to shift our classification. Now we classify AI into two main categories. We either classify it as a discriminative AI or a generative AI. Intuitively speaking, the discriminative AI is any artificial intelligence-based model that looks at features in data, and based on that data is able to predict or make a classification, such as disease, non-disease. Generative AI takes that intuition a step forward and looks at features and data points in the given data and learns those features and generates new data. This can be text, as in the case of ChatGPT, and can also be developing new images or pixels in case of image generation, such as DALL-E, etc. With that context, I would like to come to the main fold of generative AI, which is large language models. So large language model, as their name suggests, are large models. These are foundational models, which is a specific type of artificial intelligence that is based on transformers. And they can be pre-trained and then fine-tuned into a specific task. They are large because ChatGPT 3.5 had 175 billion parameters. ChatGPT 4 has 1.5 trillion parameters, and they are increasing with the different kinds of AI models and language models that are coming in. So how are these models trained? Please also remember that although I have taken an example of ChatGPT here, the intuition of training these models always remains the same. So when a researcher or when a company wants to develop a pre-trained model, what they do is they usually take a large corpus of text, usually internet data, and give this data to the model on the transformer-based architecture, which learns the subtle nuances of text with one another, and then basically becomes a predictive model. So it likes to it understands the context of one word to another, and then makes predictions based on that. Once this pre-training cycle is done, it then undergoes a process known as supervised fine-tuning. So what happens is that this model, which has already now understands the context of language, for example, is then given certain examples in which it needs to be further fine-tuned into a downstream task, for example, a conversational task. So if you want to train a model to make conversations, you just give it again a large corpus of conversational text so that it understands that if somebody is asking a question in this way, this is the way to frame the answer. So again, it learns the patterns from it. And then finally, these models are fine-tuned by a process known as reinforcement learning. So what happens is that, okay, so you wanted to create a conversational chatbot. The conversational chatbot was trained on a large language model, and then supervised fine-tuning was done on on a large corpus of conversations. So then a subject level expert or a domain expert would sit with the model and then start making conversations again. And it is during this process that it will rate the output of the model. So it may be a poor output, it may be a good output. And based on this rating, the model updates its internal parameters and then tries to generate a better rendition of whatever it had generated before. So this process is known as reinforcement learning. So all these three processes come together when you want to train a model such as ChatGPT. But we know that models like GPT have their downsides. They tend to hallucinate, and this hallucination is usually, it comes out of number one. Most of the models have a training cutoff time, and there are different various training cutoff times which I mentioned. Um, they sometimes lack domain specific knowledge because most of the time they're trained on internet data, and at times, the training data is contaminated with biased data too. For example, if you're using Reddit, you would know that this is one of the most biased site in which different kind of people just come in and do or talk about different kinds of things. So all these things come together in sometimes when we generate outputs, the outputs are not that great. And most of the outputs that are generated are usually journal products. So as researchers, what can we do in order to improve the outputs of these models? So as researchers, we have different kind of tools available to us. And in our toolbox, we have some things known as prompt engineering. We have another tool which is known as retrieval augmented generation. We also may have access to fine tuning or parameter efficient fine tuning. In the context of this presentation today, we'll only be focusing on prompt engineering and retrieval augmented generation, because fine tuning and PEFT requires much more compute that is usually available to normal researchers. It is beyond the scope of the presentation. So let's look at a process in which how a prompt is generated and how we can make a nice prompt in order to generate outputs which are useful for us. So whenever we give a query to a large language model, it comes with an output. If in addition to this query, we add a system message to it, system message usually entails defining a role to the model. So for example, we'd say, okay, you are a neurosurgeon assistant. Then we provide instructions. We say neurosurgery assistant, you are to provide the following information. And then we also let it know what is the best desired output. Another technique that researchers now using is known as chain of thought reasoning, in which you tell the model to do a step-by-step approach, and it has been noted that the outputs will actually increase. Another thing that we can do is, okay, with doing this system message, we just generate output. This is known as zero-shot prompting. However, if we also feed the language model desired questions and desired outputs, is known as few-shot prompting. So here is an example of a prompt that we had made for one of our studies that we did when we were working with large language models. So I said, I want you to role play as an AI assistant for dental problems. You will provide me with answers to given problem. The answer should be as precise as possible in no more than 50 words. So you can see that the role was defined, and I specifically told the model that you are an AI assistant for dental problems. Then we said your task would be to give answers to given questions in a precise manner. And then we also let it know what the desired output would look like. We said, do not refer to empirical remedies, do not answer any irrelevant questions unrelated to dental problems, and do not answer any medical health problems, and also never break character. So it has been noted and research has shown that if you have a nicely generated prompt that you can inject into the system message, the outputs will increase or improve. The other technique that I wanted to touch upon was retrieval augmented generation. So most of the time we know that models like ChatGPT are general purpose models, and whenever we ask them questions, the answer that is generated may also be very generic, number one. And the other thing is that if you will not have citations with that answer. So researchers came up with an intuitive technique in which um, if you want the chatbot to answer your query from a certain given text, you can also feed the text to that chatbot um, separately through another model, so that when you generate the query, this text also goes through the model itself, and the model then generates an output based on your query and the text that it had received. So that's the simplest way of explaining this. So basically, what happens from a scientific perspective is, okay, so if I have a if I have a text, for example, guidelines of neurosurgery, I can train a chatbot in which the chatbot would always have access to these guidelines, and it will make a database. We usually call it a vector database of those guidelines. And then when a query is generated, the chatbot first refers to those vector databases and looks for the answer from that vector database. And most of the time, if the query is related to that vector database, it will generate the answer out of that vector database and also give you a citation from. In the unlikely situation that it is not able to generate the answer from the vector database itself, it will let you know that it was not able to find the answer from that database. So these are two techniques, prompt engineering and retrieval augmented generation, in which researchers have been working on trying to improve the model performance. And with that in mind, we also came up with a focused question that we wanted to see whether retrieval augmented chatbot, which was at that point in time ChatGPT 3.5, would do better or worse than a chatbot which was general purpose. So what we did was we collected a corpus of uh, text specifically representative of post-operative instructions after dental procedures. What we did was we made a vector database of that specific text, and then we trained the model on that text. On the side, we also ran a general purpose chat GPT, and we basically injected both the models with the same base prompt, which I had told you earlier about. And then we generated outputs. These outputs were a series of curated questions which were usually representative of patient-based queries post procedures, representing different kind of specialties, including oral surgery, root canal treatments, etc. And then once those answers were generated, these answers were then sent out to subject level experts, and these subject level experts were asked to rate the answers in terms of their relevance, their clarity, their accuracy, and up-to-date knowledge. So we found that retrieval augmented generation actually improved the model of performance by almost 4%. So this was significant. This work was published only recently and can be accessed at the reference provided. So most of the time, the model performances are usually checked by different kinds of outcome performance metrics. These include perplexity, Blue, Rogue, and F1 scores. But when we look at these generations, I have personally noted that the quantitative variables such as Blue, Rogue, and F1 scores are not applicable, especially when the generations are large. So we need human evaluators to look at these generations. And usually, most of the time, the evaluation is based on Likert scales. So there is an area of research in which this can be made a little bit more uh, quantifiable and less subjective. Another solution in which we use generative AI is teaching and learning. We know that different kind of learners have different kind of learning preferences, and some learners are visual learners. Some learners learn at different day of time. So in order to increase access to learning, we thought that we'd apply AI and see if that really helped. And with that background, I also wanted to talk about the two sigma problem. Benjamin Bloom was a researcher in education and teaching, and he said that teachers have a two sigma problem. What that means is that if you provide personalized teaching to a student, the output of that student actually increases, or the performance of that student actually increases by two folds, or two standard deviations. However, since the teachers are less and the students are more, we will now never be able to tackle this two sigma problem with the resources that we have. With the advent of AI, there is a chance that we can actually circumvent the two sigma problem, because we can provide individualized teaching through these generative AI models, so that the learners can learn according to their learning preferences and their learning needs. In order to test that, we did a study in which we utilized AI in our journal clubs. For our journal club meetings, what usually happens is the residents are given a journal club article 1 week in advance, and they are supposed to read the article and come, and then we usually read the article in class as well. And what I used to find was that the learner engagement was different, because in our residency program, we have around 8 residents from different aspects of their experience in learning. We have year 1 residents who have less domain knowledge. Then we have year 2 and 3 residents who have more domain knowledge but less statistical knowledge. And then we have year 4 residents who have more statistical knowledge. So during our journal club article reading phase, I always used to find that we have this issue in which engagement of the junior residents was not as much. So we thought maybe if we provide these articles 1 week beforehand and train the AI-based model using retrieval augmented generation with statistical methods as well as domain-specific knowledge, would our learners be able to learn better, and will there be a better engagement during the journal club sessions themselves? So we were able to train a model, and the model would look into queries and also give answers, and these answers will usually have references with them. So we've actually gotten great results with this. The final assessment of the outcomes in terms of from a learner perspective is still ongoing, and hopefully the paper will be out soon. With that background, we've completed our talk on large language model as a generative AI. Another modality that is used as a generative AI is multimodal models. So what multimodal actually means is the model can synthesize not only textual data, but can also synthesize images as well as voice, and then also give output based on images and voices. So this was the next step or the next generation that came out after the large language models. So we also wanted to experiment with that. And um, so one big issue that we've always been grappling with in dentistry is dental traumatic injuries or dentoalveolar injuries. These injuries usually happen to children who are either in schools or in playgrounds. And when these injuries happen, they are uh, they are time sensitive in a way, because if you need to provide treatment as fast as you can in order to improve outcomes. But what we noticed was that most of the time the first responders were either teachers or sick bay nurses, or if they even got to a hospital, were healthcare providers and but not dentists. And this means that a lot of time as well as resources are lost, and sometimes at the end of the day the child also ends up losing their teeth or requiring interventions which may not be needed if an early intervention can or would have been done by the first responder. So in order to mitigate that, we wanted to create an app, and this is a multimodal app in which the model not only takes in text input, but also looks at visual images. So you can take an image with this Android-based app, and based on that image, the model will recognize what kind of trauma had happened and what kind of teeth it is and what kind of intervention will best suit it. Another
I'm a first responder
aspect that we
and
added
I
is the
have a
voice
dental
coding.
injury
Listen
case
to that.
in my school.
Got it. For dental injuries, control any bleeding with gentle pressure using a clean cloth or gauze. If a tooth is knocked out, handle it by the crown, not the root, and try to place it back in the socket or keep it in milk until reaching a dentist. Seek professional dental care immediately.
So this is again an example in which generative AI is being utilized by our team to again democratize healthcare, improve access, and improve outcomes. Another area of emerging um, field of research is generating synthetic data sets using AI. So we all know this, that artificial intelligence is data intensive. There are a lot of concerns around the data itself. So there are data privacy issues. People are not able to share data because the data may contain information regarding the patient itself, or there are certain regulations, especially in the EU, in the US, such as HIPAA, in which the data cannot be shared in between countries, or the data has to stay in the country of origin. Likewise, there are issues of data biases. For instance, most of the healthcare data you will represent more disease, or disease prevalence in that data is more. Also, concerns are that the geographical distribution of the disease itself may be different, and therefore the models are not able to generalize well. Other concerns are, okay, different machines will generate different kind of images, so that's a concern. Then there are ethical concerns. So if there is some kind of data, who does that belong to? The patient? Are we um, are we undermining the patient's rights in some way, in which if we are treating an algorithm based on images from that particular patients. And finally, data annotation is very labor intensive, requires a lot of annotations and annotators and curations, requires a lot of compute too. So in order to mitigate these challenges with data, especially with radiographic or pictorial data, we thought that it may be a great idea if we can generate our own data. And in order to do that, literature has shown that there are generative AI available which can generate images if they are trained on a certain level of images. Remember that I spoke about how generative AI learns patterns from data and is able to generate new data points from that learning. So the same intuition goes behind generating artificial data sets or synthetic data sets. So one intuitive way of generating synthetic data is using generative adversarial network. So a generative adversarial network usually contains two deep learning models. One deep learning model is known as a generator, and the other deep learning model is known as a discriminator. So what happens is the generator usually is trained on large amount of pictures, and you after it is done its training, it takes a lot of noise such as Gaussian noise, um, which is then utilized to generate a new image. The discriminator looks at that image and makes a decision whether the image is real or fake. If the generator discriminator is able to discriminate the image well, it wins. So if a fake image was generated by the generator and the discriminator says it was fake, it wins. Then what happens is that the discriminator lets the generator know that your image was fake, and the generator then updates its internal parameters, tries to generate a new image, and then this gamification of generator versus discriminator goes on till we are able to generate images which are lifelike. Likewise, another process is known as diffusion, in which again a large training data is utilized and then a noise is gradually added to this training data. So imagine this image in which noise is gradually added, and then it's added to an extent that the image itself becomes pure noise. Then the diffusion model is trained to remake the image from that noise to its original form. So this iterative cycle of noising and denoising of images by that model teaches the model underlying context in which one pixel has a connection with the other pixel. This way, the model can be trained to generate new data points and new images. So with this in mind, we also tried to do an experiment in which we wanted to generate images using GANs as well as diffusion models. And we wanted to find out which model did better. So the training was started on OPG radiographs because this was the biggest data set that we had. And we utilized a diffusion model as well as a GANs model, and then started training the data. But what we found at the start of the experiment was that the diffusion model was doing well. However, but the GANs model used to have a problem in which the images were not of good quality or good pixel value. And then if we wanted to increase the pixel value of the image itself, the model would collapse. So we had to stop training more images on GANs model, and we just continued with the experiment with the diffusion model. Once these images were generated, uh, we we gave these images to domain experts, including faculty residents, as well as other AI models. And we wanted to find out who is the better discriminator between the fake image and the real image. Is it are faculty able to classify an image as fake or real? Likewise, are residents able to classify images as fake or real? And are there any AI models which can do this for us? So these are the results. we found out that in our experiments that humans, which included not only faculty members but also residents, were poor classifiers of disease of real versus fake. And we also noted that the AI models were actually very good classifiers. So they were able to differentiate between a fake image and a true image. So we wanted to further find out how the AI is able to do this classification so well. So we used another strategy known as explainable artificial intelligence. And here is an example of the original image and the synthetic image. And in what explainable artificial intelligence does is it looks at a particular feature in the image, and then based on that feature would classify the image as real or fake. And what we noted was very interesting, that most of the time the AI model, especially in the case of fake images, the um, the AI model was concentrating more on the periphery of the image as opposed to the center. So we feel like that there are certain artifacts that are generated when synthetic data is being made. These artifacts are not human indistinguishable, but are AI indistinguishable. But an area of future research which needs to be further validated. So to conclude, large language models as well as diffusion models have a lot of use cases. Language models can be used for education, patient education as well as student education. And with multimodals, there are versatile application in which images and sound can also be utilized to train as well as get outputs from AI. Likewise, diffusion models can be a viable alternative in generating synthetic data to train future artificial intelligence-based models. With that being said, I would like to conclude my presentation. I'm very, very thankful to my team members who have been working with me for over the years in getting these models working as well as now making deployable solutions. And I leave you with these AI generated images which were generated in our lab. These are OPG images, all of them are fake. Thank you very much. And now I am open to questions if there are any.